provide for privacy. I'm gonna wash my hands. Good afternoon, Mr. Owens. My name is Lexi, and I'm gonna be your student nurse today. Are you able to tell me your name and date of birth? He does, and it matches the mark. And Mr. Owens, are you allergic to anything? He is. He's allergic to morphine. I see that you have a central lining and you're still receiving chemotherapy, so we're going to go ahead and keep that central lining. And you're also having some pain as to why you're requesting some pain meds. Because you're allergic to morphine, I'm going to be giving hydromorphone today. You don't have to worry, there will be no contraindications. So I'm going to go ahead and look here. So we're administering hydromorphone today. It is compatible with normal saline. It does not need to be diluted, and the rate is going to be 1 milliliter per every 2 to 3 minutes. After I give this, we're going to watch for any adverse reactions. Some adverse reactions may be respiratory depression, hypotension, or apnea. So I want you to let me know if you feel any of that after I administer it. So I'm just going to do a check here. So I have Bob Owens. Bob Owens' birthday is 9/22/1933. 9/22/1933. He's allergic to morphine, so I am giving hydromorphone today. Oh, I'm sorry, he's allergic to morphine, and I'm administering hydromorphone today. I have ordered here 1 milligram, and I have a syringe of 2 milligrams per 1 milliliter. After doing a calculation, you'll be getting 0.5 milliliters today. I'm going to be giving it IV push every 3 hours for pain, but since you have yet to get it today, you're due for it now. So I'm going to go ahead and just wash my hands. And I'm going to be assessing that IV site. I'm just looking to making sure that it's not infiltrating, if there's no infection, and that it doesn't look like it may be displaced. It doesn't, so we're going to go ahead and use it. I'm going to take off my gloves and wash my hands. I have also checked that the normal salines are all not expired. Neither is the hydromorphone. I'm going to go ahead and I'm just going to wrap these. Alright, I'm going to get dose accurate. Making sure that there's no air bubbles. I actually forgot the needle. So I would have came more prepared and would have got the needle. So I'm gonna have to step out. Oh, just kidding, I don't need a needle. Oh my gosh. Just ignore that whole comment. There's one air bubble in here that does not want to get out. Okay. So if there is still the little air bubble in there, it would not be if I was going to administer it. Alright. So, Mr. Owens, because I need you to keep your arms still. Are you able to keep your arms still and follow my commands today? He says he is. Had this been a child, I would have to have an adult in here or a second person to help me. And before administering this, I have my gloves on, I wash my hands, and I'm going to do my 5 checks 3 times. So I have Bob Owens, birthday 9/22/1933, 9/22/1933. He is allergic to morphine. I'm giving hydromorphone today. Ordered is 1 milligram. After calculating the math, I'm going to be giving 0.5 milliliters which I have, 0.5 milliliters. I'll be giving it IV push every 3 hours for pain. He has yet to receive it today, so the time is now. So I have Bob Owens. Date of birth is 9/22/1933. 9/22/1933. He is allergic to morphine, so we're giving hydromorphone today. Ordered is 1 milligram IV push. After doing my math calculation, I should have 0.5 milliliters. I have 0.5. I'm giving it IV push every 3 hours for pain. He's yet to receive it today, so the time is now. Bob Owens. 9/22/1933. 9/22/1933. He will be getting hydromorphone because he's allergic to morphine. He is ordered 1 milligram. After doing the math calculations, he should be getting 0.5, which he is. He's getting an IV push, and he'll be getting it every 3 hours for pain. Alright, so I'm just going to wash my hands. Sometimes I touch them all. If anything, I could just put on new gloves. Alrighty, so I'm going to go ahead and I'm going to open the clamp and I'm going to cleanse it. My protocol, or my facilities policy, allows for the protocol of using alcohol wipes, and we can do it for 15 to 30 seconds. This may differ depending on your agency. Alrighty. And I'm going to take my first normal saline and just make sure that the line is still working.
Hello, my name is Lexi. I'm going to be your nurse today. I'm going to wash my hands.
Alrighty.
Tell me your name and date of birth.
And then I'm going to get another alcohol wipe.
12/12/1999. Do you have any allergies, Bob?
And I'm going to cleanse again
Well, I'm going to go
for
ahead
15 to 30 seconds. This time I will be administering the medication. So like we talked about, those adverse reactions, that hypotension, any respiratory depression, please let me know if you feel any of that. The rate of this is to be administered over 1 milliliter every 2 to 3 minutes. So that is how I'll be administering it today. Watching the time. Due to time purposes, I'm just going to speed it along. Are you feeling okay, Mr. Owens? He says he is. I'm going to grab another alcohol wipe. Cleansing again for 15 to 30 seconds. Alright. Now this normal saline, I'm going to administer it at the same rate as the medication was. So I'm going to be administering 1 milliliter for every 2 to 3 minutes. I'm doing this to make sure I'm flushing out the entire line and making sure no medication was left. I also have to do this for at least 5 milliliters. Just to make sure that we got everything. Again, watching the time, and for purposes, just going to speed it up. Okay. And a final wipe for the last normal saline.
It is compatible. The hydromorphone is compatible with normal saline. I looked from my buddy book. I'm going to give them that over 2 to 3 minutes. There's no need for dilution.
Okay. And this one, I'm going to be administering at a pulsating method. So I'm going to be doing 1 milliliter per minute. And then stopping. Again, for time purposes, I'm going to speed it up a little bit.
And I'm going to assess my IV site. So you can see it's covered. So I'm going to go ahead and check for infiltration, any tenderness,
Okay.
feel any pain.
And then I'm going to go ahead and reclamp this.
There's none. So I'm going to go ahead.
I would take care of all my supplies. How are you feeling, Mr. Owens? He says he's feeling fine, so I'm going to go ahead and take off my gloves, wash my hands. I'm going to make sure he's in a safe position, hand him his call light, and then I'm going to document. I'm going to document my assessment finding of his site where the IV is. I'm going to document what I gave, how much I gave, how he tolerated the time I gave, and if any side effects he experienced happened, I would document that as well.